ribbit, ribbit. This is Seven Song at the pond here with Juliet behind the camera. And I'm holding buttonbush, but I'm not going to talk about it. It's behind me. So I'm at the pond where I live, and I wanted to talk about one of my favorite plants that grow by the pond. And this plant right here, and this plant right here, these are Blue Vervain. The genus is Verbena. The species is hastata. So Verbena hastata, and it's in the family, the Verbenaceae. And so blue vervains are native here. Actually, this area was overtaken by irises and other non-natives, and I reintroduced the vervain, and it's doing okay. It's slowly coming in areas where it can. And these plants, unfortunately, don't really give you an excellent show. Often Verbena hastatas are more this height, higher, you know, half this again, or even taller, with beautiful purple candelabras. But it does have very showy purple flowers, and they're just very showy plants, often very hard to miss where they grow. And they tend to grow in moist areas, so swamps and marshes, the edges of ponds like right over here. So basically, it's not usually in the water, but alongside the water. And some of its other medicinal compatriots that are native around here that you might see it next to would be Joe Pye weed, Eupatorium maculatum, and also boneset, another Eupatorium, and that's Eupatorium perfoliatum. Often you see the three of them, Joe Pye weed, boneset, and blue vervain growing near each other. And just often a very lovely triangle of plants, along with all the other wetland-loving plants. And so the main way that I use blue vervain is as a nervine, or nervine for me means nourishing the nervous system. And the parts that I use, I'm going to cut one of these vervains down. The part that I use for medicine is going to be the leaves and flower tops. I don't use the stems. And so I just whoosh the leaves off this way, and then I pop it. And so this is the part that I use for medicine. It's not very aromatic, the plant. And then the two main things I'm going to do with this plant after I gather it is I will dry the flowers and leaves for tea, and it's a very bitter tea. It's not the most bitter, but it's like on par. If you ever had yarrow tea, it's on par with yarrow as far as bitterness. One day somebody can make a bitter scale, like from starting like chaparral with very bitter to mildly bitter, like some of the gentians are mildly bitter. So I like to make the tincture 1 to 3, about 70 or 80%. The reason not so much alcohol is the plants are pretty dry. They don't have a lot of water in them. So depending on the quality of the plant, it's usually somewhere though like 1 to 3, 80% ethanol for the leaves and the flowers as tincture. I think I use the tincture more, and I'll explain why in a second, but I definitely, for some people, the tea works. So you can both use the tea and the tincture. And the reason I sometimes like the tincture more, meaning the plant and alcohol, is that for some people who are going to use this plant, it's really helpful to take it 3 to 5 times a day. And it's just easier to take something 3 to 5 times a day in tincture form. So now comes the question of why do I use Verbena hastata and the Verbenaceae, commonly called blue vervain. And the reason is I think it's one of the most nourishing nerve tonics. So nervine is the word that I use, meaning that it nourishes the nervous system. Other people use other words. A former word that I do really like a lot but don't use as much is neurotropho-restorative. Neuro, nervous system, tropho, form, restorative, bringing back balance or bringing something to its function again, making it functional. So next though is whose nervous system are we trying to tone? And so the blue vervain is best for people who, it's just simple. When I was younger, we would have called them type A, but we can say just uptight, or people who just, if things don't go their way, they get tighter and tighter and over-thoughty. So probably nobody really likes when things don't go their way. But for a certain group of people, in Ayurveda you would say pitta type folks, when things don't go their way, they try to get more controlling, control the situation, and anger is often one of the ramifications. Rather than crying or befuddlement, often you find this kind of person, so there's a plan and they get a flat tire driving there, and it's important that they get there, or not that important, and all of a sudden they're just getting angry and telling everybody what to do. So of course we're only, if somebody does that occasionally, that's just considered normal. But if you're constantly trying to control, here's some ideas that this might be you. If you have contingency plans for your contingency plan, this might be you. In other words, so yeah, a contingency plan is like, if this doesn't go wrong, if this goes wrong, we could do this. And you're also thinking, well, if the thing that we make a plan for goes wrong and the first thing goes wrong, we can also do this. In other words, you're really tightly controlling. If the best thing in the world in your life is finishing a list, and you actually almost always finish your list and cross them out in very distinct lines, and then you immediately start a new list. And if you feel frustrated if you don't finish your list, because many people make lists, this might also be you. So there's just a whole bunch of saying, like, it's just people who hold on a little too tight. And so sometimes they're anxious, but I would say more than anxious, it's people who are overthinking. And there's a couple of ways of overthinking. You can be overthinking where you have way too many thoughts and they're all cluttering, but none of them is specific. Like, they're just little threads that are disconnected. That's not this. This kind of person is you have many specific thoughts and you don't know which specific thought you should go with, because they're all like, each one is like linear and clear and distinct. So there's many ways to be saying the same thing, but often I find when these people are out of balance, there's a few things that happen. First, often not very good listeners. And they're not good listeners. There's two ways to not be a good listener. There's many ways. But this kind of way is you're thinking too much. And so you're not listening because you already have a plan, or you're waiting for that person to finish to just say what you want to say. This is classic for this. Because some people, for instance, who are more Vata, another Ayurvedic dosha, they might not be good listening because they're distracted. There's bird sound around here. There's a lot of distractions. There's bird sounds and the sounds of wind and the smells of things. So again, though, that's not this person. This person is thinking too much and so not listening. And often, frankly, I think if people can't help themselves and interrupt and tell people what's in their mind rather than listening well, I think sometimes, so that could just be a pattern and a habit, right? But if this is you, and you don't like this about yourself, and so you want to nourish your nervous system, but you're not looking to sedate, because Blue Vervain is not very sedative. It's not valerian, it's not skullcap. Skullcap, by the way, is just growing right up over here, because skullcap is another wetland-loving nervine plant. But so you want something that just relaxes your nervous system, so you don't feel quite the need to be in control. So your stress level just start to come down. Now, of course, you also have to do stuff. I mean, you also have behavior modification. A lot of these things are learned responses, but you're doing that, and you also want some backup. You just want your nervous tissue to feel better. And then I would suggest Blue Vervain, because it won't really decrease your function, but it's not like you're at the height of fighting and you're like, oh, I just need something to stop fighting, and then you take tincture of Blue Vervain. I mean, if something helped you there, it'd probably just be the alcohol. But if you take it over the course of days and weeks, often people just feel a little more in control. They feel like their nervous system is a little more replenished. And so speaking of replenished, the other group that is helpful is people who do control a lot and have been doing that for too long, and then they become burnt out. So you're burnt out activists, or you're somebody you've had a job and you've been the sole proprietor of a job for many years, and you've run a restaurant. And you've had to do everything for the restaurant, and you've done it, and you've done it, and you've done it, and you've done it, and now you're pooped. And now you have to sleep 8 or 10 hours. Some people will use the word adrenal exhaustion. For me, adrenal exhaustion, even though the adrenal parts of the adrenal gland are associated with the nervous system, I tend to think of it as this kind of burnout as a nervous system problem. And for this, what you want are nerve restoratives. So if you're the kind of person who has pushed yourself to the point of exhaustion, and now the exhaustion is very commonplace, also this plant can be very helpful. Again, you might have to do other things. You might have to think about diet and actually getting enough rest. But I consider this plant an excellent tonic for that. it works very well. Another plant that works similarly, and I think some of the parts are similar, some are dissimilar, is this and passion flower. So sometimes I combine Blue Vervain with Passiflora incarnata. That's the most common passion flower used for medicine in the United States. And you can also combine it with other stuff. Skullcap is a nice herb to combine with Blue Vervain because it kind of tones down, it helps relax the skeletal muscles, because you're also, so you're a little bit hot wired in your mind, but your skeletal muscles are also tightening in reaction to your mind, or who knows which is following which. And skullcap is nice because for some people, not everyone, it's also not, it's a little bit sedative, but not too sedative. So Blue Vervain is a plant that if you're going to use it, you want to gather, like it's not a 1 ounce plant, it's not a 1 ounce of tincture. It's the kind of plant where you're going to make yourself 4 or 8 or a quart of tincture and take or give to somebody over a period of time. It's not miraculous. The person still has to consider their actions and how they're living their life and what's making them overthinking all the time. And then if they don't want tincture, you can make a tea out of it. I would say, you know, this would be maybe a cup at the most. For Blue Vervain for tea, I would probably have maybe this much to a quart. So if you're using a French press, which I suggest, a coffee press or a French press, maybe this amount to a quart of water. Just pour boiling water on it. And you can just drink it in half-cup portions. You can try to make it taste better with other plants, so it is bitter. For tincture-wise, so half cups 2 or 3 times a day. Tincture-wise, a really nice way to make the tincture, to take the tincture, would be something like, depending on your sensitivity to plants, something like half a dropper full. Half a dropper full is about 0.6 milliliters. If the 1 ounce dropper, about this much of it, to 2 dropperfuls, about 2.5 milliliters, which would be, you know, if this was a dropper, there'd be 2 of these full, 3 to 5 times a day. It's really great to take this on a regular basis. So maybe small amounts or medium amounts or larger amounts, but steady, 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 so that your nervous system, because it's not an SSRI, it's not that strong a drug. So this is not a pro or anti-modern medicine. This is a pro-Blue Vervain. And so regular amounts seem to help some people. And so I would suggest finding it. If you're going to gather it again, you cut it towards the base of the plant. But if you're going to gather it, so it's not endangered, but it's beautiful and it's lovely to see it in large fields. So if you're gathering it in the wild, just make sure that you're not harming the aesthetics of the area, right? So there could be a lot and you can gather it all and it'll come back. But meanwhile, people like myself who just love to walk in swamps and see it would find it less a beautiful environment. So be cautious that way. The plants, I think, are short-lived perennials, so we just cut it at the very base and strip them down, and then go around and just be cautious so you're not stepping on, you know, on wetlands and altering it too much. But again, it's not a threatened plant. So I hope you enjoy this beautiful plant. I hope you learn to make medicine from it. And that's it. Blue Vervain to you.